Good morning. I will be discussing data sets and information management. The learner for this is going to be a practicing nurse. So first off, we're going to start off with what is a data set. So data sets can include information such as genetics, physiological attributes of a patient, and behavioral attributes. All of these data points can help scientists address certain populations' response to a health crisis or a terminal illness. The use of electronic health records ensures that data sets can be obtained. And electronic health records also ensure patient safety. An example of how electronic health records ensure patient safety is the barcode system. So a barcode system is basically the patient is given an ID band that has a barcode embedded in it. So the patient is scanned before a medication is administered to the patient. After the patient is scanned, the nurse then verifies the patient's name and date of birth. And if the patient's not scanned, then it doesn't let you go any further. So depending on the type of electronic health record you're in, it could be a green check or it says scanned, that kind of thing in the patient's chart to ensure that you have done that. And then the next thing you're going to ask the patient their name and date of birth to verify that the chart that you have open is the correct patient. The next thing you're going to do is you're going to scan the medication, ensuring that you have the correct medication for the patient. And then the nice thing about an electronic health record is that a pharmacist is going to go ahead and verify that medication before you can actually pull it out of the Pyxis medication system. So the pharmacist is going to make sure that it is a correct dose for the patient, that it's not too much of a medication or too much of a dose for a medication. They're going to make sure that the medication prescribed is not going to interfere with the medications that they already take at home. And then the last thing is make sure that they're not going to have an allergic reaction to it or have a previous allergy to this type of medication. And all those obviously are going to help with patient safety. So an example of a data set here is the nursing minimum data set. So health information technology offers a large number of benefits to the nurses and healthcare providers, as well as the patient and consumers, such as the quality and effectiveness of healthcare delivery and service. The nursing minimum data set provides a formal structure for electronic healthcare data elements and components to support nursing care in all settings. The NMDS is comparable to other healthcare data sets, except that it includes an additional nursing care element and a unique provider number for each healthcare provider. So how are data sets used? A couple of examples. The nursing minimum data set and the nursing management minimum data set, the logical observation identifiers and codes, and the systemized nomenclature of medicine clinical terms. So the two data sets that are recognized by the American Nursing Association are the nursing minimum data set and the nursing management minimum data set. The nursing minimum data set includes clinical data that is focused on nursing, and the nursing management minimum data set is focused on nursing care. So both of these data sets provide valuable information that can influence patient outcomes, and how patient outcomes are influenced is they actually define the care that is to be delivered to patients. So this is providing a standard of care that all patients should have regardless of what institution they're in or what state they're in. The nursing management minimum data set can be used by nurse managers. So this can be used if they want to compare how their nursing practice compares between one hospital system to another within a state. So if you wanted to compare your medical surgical floor at Strong Memorial Hospital and your policies and procedures and practice to how it works at Rochester General Hospital. So you're comparing within states. It can also be done or within institutions within the same state, so just two different healthcare systems. It could also be done from one state to another. So if you want to compare how Strong Memorial Hospital differs from Cleveland Clinic, that kind of thing. Another advantage of using data sets is nurse managers can determine how to staff their unit. So obviously nursing staffing is linked with patient outcomes. So obviously if you have so many patients to very few nurses, then that's going to affect your patient outcomes because of the fact that the nurses aren't going to be able to care for the patients due to the fact of being overwhelmed by having too many. How the nurses are scheduled and the shifts that they're assigned to work. So shifts assigned to work are, in a normal medical surgical floor, you usually have like a 7A to 7P or 7P to 7A because your patients, depending on discharges, probably stay the same during the shift, whereas in the emergency room, you kind of build up to your workload, so you need to go ahead and have nurses kind of trickle in during the day, and data sets would help nurse managers determine when to have those nurses trickle in during the day, and then how many absences occur on the unit. So around certain holidays or certain events, that kind of thing, is that when you see more absences on your unit. And then the SNOMED and LONIC are by the American Nursing Association. These are the two data sets that they have recognized to encompass nursing care. So the logical observation identifiers and codes is data derived for laboratory results and clinical assessment of patients. So these databases have expanded to include medical and laboratory code names. The purpose is to assist in electronic exchange and gathering of clinical results, such as laboratory tests, clinical observations, outcomes management, and research. And the systemized nomenclature of medicine clinical terms focuses on patients' clinical findings, interventions that were performed, and the patient outcomes. So electronic health records are utilized to obtain this information. And the American Nursing Association created a national clinical data repository in 1994. The National Database for Nursing Quality Indicators was created to ensure patient safety along with quality improvements that should be implemented. So it gives great information as to what you can do better within your organization. So that's examples of how data sets can be used. Information management can be used in providing informed, safe, quality health care by providing nurse managers with the essential information they need to know in order to staff their unit. So nursing information systems allow nurse managers to ensure that their unit is staffed appropriately. So this includes nurses' skill levels. So in choosing your staffing, you want to make sure that you have a blend of novice nurses with experienced nurses, not just a entire staffing of novice nurses that could lead to poor patient outcomes. So you want to make sure that you have some experienced nurses available as resources for your novice nurses in case they have questions or concerns. Another benefit is that there is less time spent on developing a care plan for a patient. So you're just using your electronic health record and creating your care plan that way. And having less time developing care plans, you actually are able to spend more time in your patient's rooms. And lastly, there's less risk of a medication error. Medications are prescribed electronically, so that leads to, as I discussed earlier, less of a risk of the wrong medication being given to the patient. Also, the wrong patient receiving the medication. So with scanning, you're making sure that you're not giving Mrs. Jones, Mrs. Smith's medications, that kind of thing. So advantages are better staff management, as we discussed, making sure that you have enough staff available to care for your patients, and ensuring that you have the correct ratio of novice to experienced nurses. Improved documentation. So your documentation is going to be standardized based on the fact that electronic health records, everything's pretty much the same. So depending on what system you work in, they have critical components that need to be documented on every patient. So you're going to have your patient education and safety that has to be documented on every patient. So therefore, your patient chart should look the same with having that critical documentation for each and every one. Disadvantage is a need for training. So any updates that come to an electronic health record, which there are numerous, you're going to make sure that you need to provide time for your nurses to learn that new information. An example in our hospital system is we went from using Lexicomp for all our medication lookups, IV compatibility, how long to administer medication, to Micromedics, which that system works differently. So you need to provide your nurses time to look over that new system and how it works. And then long charting time can be another disadvantage depending on how much charting you actually have to do. For providers, they have what's called the Dragon, which is an electronic dictation system that they can use to help cut down on longer charting time for them. And lastly, our conclusion. So data sets and information management provide numerous benefits to providing safe, quality healthcare for patients. As discussed, electronic health records plays a huge component in this, with providing not only information for the clinical data repository that nurse researchers can extrapolate information on how to improve quality improvements in patient care, but they also make sure that we have the correct patient that we're administering medication to, we're administering the correct medication, therefore ensuring that our patients are provided safe care.